question in from a listener. If you are diagnosed with an enlarged prostate, is it possible to reverse that condition without surgery? That's part one. We'll get to part two in a second. Gentlemen, enlarged prostate, can it be reversed any way other than surgery?
It can be reversed with medications.
Okay.
So there are a few different ways to take this, and it would probably have to, require getting some more information.
Right.
But I think the most direct path and the path that you prefer is if you're having just some basic symptoms, but your numbers are coming up okay, your PSA numbers aren't elevated, but you're having maybe some symptoms, a lot of urination at night, incomplete emptying, those kind of things. If you can go on a drug like Flomax, before you would get put on something like finasteride or Proscar, taking a much better approach in terms of side effect profile. And the reason for that is because a Flomax or a tamsulosin, that is basically just kind of relaxing the muscles in the bladder and around the bladder area.
Okay.
It can have a little bit of blood pressure effect. They can lower your blood pressure a little bit potentially. That's a side effect to watch out for, especially kind of standing up in the middle of the night, those kind of things. You usually take that at bedtime. But that can at least help to remove the symptoms. It's not going to shrink the prostate. It's just kind of relaxing those muscles.
Okay.
If that's not working, though, and your doctor's kind of stepping things up, again, this is assuming that your PSA numbers are okay and there's nothing worry about in that regard. Finasteride is going to block DHT. It's going to block the production of dihydrotestosterone.
Okay.
Dihydrotestosterone is a very potent form of testosterone. It's responsible, along with genetics, for hair loss, and responsible, along with, I'm sure, some genetic component for prostate, inflammation.
Okay.
So, but the problem is, it's a potent engine. It's a potent form of testosterone. So when you take that, you run the risk of some different, side effects related, sexual function, things like that, that would come from blocking testosterone.
So that's why a Flomax approach initially, if you can do it with that,
yes,
that's a better option.
Flomax, and then even a supplement. That's a good regimen. Something with saw palmetto, zinc,
right,
some things that can help to block DHT maybe in a much milder way, balance hormones a little bit. Things that have been shown to work, along with a drug that really has a pretty limited side effect profile. Those are the steps I would try to take before going on something like a finasteride. Because finasteride and Flomax, or Proscar and Flomax, they get linked together a lot.
Yeah.
And they have a similar end goal to help you not have to frequently urinate at night.
Right.
But the way they're doing it, black and white difference.
Okay. All right. So, and that answers the other question they had, was about Flomax. So that's great to hear.
Mm-hmm.
It's not a horribly complex, not complex drug, but it's not bad for you. The profile is pretty good as far as these things are concerned.
Yeah.